So I'd like to introduce our next speakers who will now take us into more background on the problem, the magnitude of the problem, and also some further insights about what we can do about it. Mike Thompson is the president and CEO of the National Alliance of Healthcare Purchaser Coalitions, of which the Alliance is a proud member. The National Alliance, or formerly NBCH, consists of about 50 healthcare purchaser-led coalitions representing over 12,000 healthcare purchasers who provide health benefits to over 41 million Americans. Before coming to the National Alliance, Mike was a principal at PricewaterhouseCoopers for 20 years, specializing in healthcare and employee benefit strategy. At PwC, he consulted with major employers and other stakeholders on sustainable cost reduction, integrated health, wellness, and consumerism, retiree health, private exchanges, and health reform. And joining Mike is Ian Shea. Ian is the founder and CEO of I Am Human, a lifestyle website and resource of real and relatable content curated by experts with social support and community. Ian has expertise in capital markets and finance and a passion for building companies like I Am Health to address unmet needs in the marketplace. Ian served as the vice president and general manager of Replay TV. He led Replay through 2 acquisitions, 2 turnarounds, a successful exit from bankruptcy, a new business product launch, and finally the company's sale to DirecTV in 2008. And Ian will be speaking after Mike. Please join me in welcoming Mike Thompson.
So, anyways, I'm going to talk a little bit about mental health from a really from a business perspective and a benefits perspective as well. As Cheryl indicated, I do very broad work in healthcare, but one of my personal interests and passion is, in fact, in the area of mental health, and it comes in part because I, like probably a lot of you, have been impacted by mental health. I actually lost a brother to suicide when I was young. I've had mental health issues in my family, and it's been a big deal. And it's funny, you know, as Dennis said, you know, we don't talk about mental health in general, but frankly, that's part of what has led us to where we are today, is because we don't talk about it. So I'm gonna give you a little bit perspective. In 2012, PwC was asked by the One Mind group to do a study of the economic costs of brain disease. And in 2012, it was estimated it was about I think this is $1 trillion, about $1 trillion. And you note that most of that is not the costs associated with treating mental health. It's the comorbidities, it's the productivity issues, it's the long-term care costs and whatnot. So it's a huge issue. And in fact, the Surgeon General said that the economic cost of mental health is actually greater than heart disease and cancer and something else all put together. It is because of the issue on productivity and the fact that it hits so early in life, or is predominant early in life. It has a huge impact. So last year, I actually wrote an article called "Moving Mountains for Mental Health," and it was and it really kind of came out of work that we did with the Northeast Business Group on Health, looking at the issues around mental health and some of the issues. And the conclusion, as you get into this, is in some ways we truly are in the best of times. You know, I lost my brother, 30 years ago, and I think my grandmother, had some sort of schizophrenia or something or whatever. So and think about where we were 30 years ago. I mean, the science wasn't anywhere near as good as it is today. The stigma was even worse. You would never have a meeting like this 30 years ago. We didn't, plan designs, you don't have to have been around very long to know we had 30-day limits on hospital. We had 10-day visit limits on mental health. Why? Because it's abusive. Why would anybody use mental health services? And of course, today we have mental health parity. You know, the laws have been changed, and the intent is to have mental health parity. And again, I do think there is this growing acceptance. I don't think we are where we were 30 years ago at all. You probably wouldn't have had me standing up here talking about my brother. We didn't talk about it when he died, right? Um, Having said that, we also have major issues in mental illness, and I think Dennis addressed some of them. Some of it is this stigma and prejudice, and it effectively causes people not to get help. I think Cheryl said something like 70% of the people who have a mental illness don't get any sort of treatment at all. It creates environments where people are nervous about it. It actually creates stress and is self-fulfilling almost in recovery. It's hard to recover when people are not accommodating. We have huge issues around access and quality. I'm going to talk a little bit about those. Today, if you look at the network situation, something like 90% of most providers participate in our networks, and something like 55% of mental health professionals participate in our networks. If you look at the percent that's out of network, there was just a study done by Milliman that showed that the percent out of network for mental health is anywhere between 4 and 6 times as high for mental health than it is for regular services. So it's and if you combine that with the fact that people themselves don't want to admit that they might have an issue, and then we create financial barriers to them to actually get help, and those financial barriers actually can create challenges for them to sustain the help they need. It's a key issue. And then the whole issue in terms of our environment around stress and isolation, and we'll talk more about that. So the conclusion we reached, and I'd like to end with a positive note, because is that we need a constructive path forward. And some of the principles we came up with through and this was a collaboration between the Northeast Business Group on Health, NAMI New York City, the center was called the Partnership for Workplace Mental Health, affiliated with the APA, and the Kennedy Forum, were 4 key principles: know the impact, break the silence, affordable, quality, integrated care, and whatnot. So just talking about our current mental health systems of support, most of you probably offer an employee assistance program. And the employee assistance program is one of the most valuable benefits you offer. They typically are underutilized. The percentage of people who utilize compared to the percentage who probably should be utilizing is significantly below expected. The provider networks have low participation rates by the mental health professionals. And what's concerning about this is actually something that's getting worse, not better. And the reason it's getting worse is we have a lot of people retiring out of these professions. And the discussions in medical school is not to participate in networks. The culture of the mental health profession is to participate outside of networks. And there's things that are contributing to that, things like reimbursement. And we talk about parity as it relates to benefit plans, but there isn't necessarily parity as it relates to reimbursement. For the same procedures, mental health professionals are actually getting reimbursed less. And what's kind of odd about that is that they tend to spend more time in the diagnosis than their medical counterparts do. In other words, we pay them for the same code less, even though they spend more time with the patient to do the same code, that initial visit. And that is one of the reasons that mental health professionals don't participate in networks. And secondly, if you actually look at your directories, if you actually try to identify someone who's available, your booklets show big networks of providers. And I don't know the situation in Wisconsin, and I'm assuming it's not what it is in New York. It might be better. Okay, I don't know. But what you will find is looking for providers isn't as simple as going into the directory. It's hard to get an appointment. There are shortages, right? Sometimes they're not taking new patients, right? And so there's this term that's kicked around called phantom networks. We have networks that aren't really networks because it's hard to actually get to one. And what we hear from EAPs at these big companies is they themselves have, if they have somebody in crisis, they themselves have a hard time finding somebody to take care of that person in crisis. And they've actually had to develop workarounds to actually make this work. So this is a serious issue. Now, the reality is most people are getting their mental health services through their primary care physician. If you look at your prescription drug claims, you'll see that most of the mental health medications are coming through your primary care physician. But the primary care physicians themselves have not been trained on behavioral health. And there are, of course, models that integrate behavioral health into primary care called collaborative care, but they're not prevalent. And frankly, most of the health plans don't reimburse for them. Just recently, there has been a new code that has been established by CMS, and Medicare is starting to pay for the collaborative care model. And now we're finding the plans starting to move in that direction. So again, a lot of issues around quality, access. We're still talking about that. It's kind of shocking that we're talking about it. And these issues are getting worse. If you put on top the fact that we've moved to high deductible plans, so the in-network benefits have a high deductible, $1,000 deductible or something, and then 80%. Well, what do you think will happen to the out-of-network? The out-of-network benefits has a still higher deductible and a still higher coinsurance, and that's where people get their mental health. It's an issue. And again, medications can be expensive. The frequency of visits can be expensive, and so that's a real challenge. And so what are those progressive steps going forward? The first key element is to know the impact. If we're going to change the path forward, we need to understand that mental health matters. It really does matter. So the suicide rates in the United States are at a 30-year high. Remember, the science has gotten better. The medications have gotten better. Our ability to deal with mental health has gotten better. And suicide rates are at a 30-year high. Up 25% between 1999 and 2014. And the largest percentage increase, people our age. It's scary. It's scary. I think people are aware of the opioid epidemic. That is not independent of the mental health issue. It kind of goes hand in hand. What you will find is when people talk about mental health and opioids, they see the two very much related. People are self-medicating through opioids as one of the sources, not the only source, as it relates to it. And the overdose death rate in this instance went up 4 times from 1999 to 2008. So again, this is getting worse, not better. In spite of the science getting better. This next one is really fascinating to me. You know, I think if we were to say, what are the biggest health risks that we face in our wellness programs and whatnot, I think we would talk about issues like nutrition and activity. It turns out that loneliness and isolation, which isn't necessarily the same thing as mental health or mental illness, loneliness and isolation is a risk factor on par with smoking. The manifestation of illness related to loneliness and isolation is as big as smoking. And yet it's invariably, you know, you talked about Dennis saying, well, how do we connect with people? How do we get people that are connected? If we start thinking more broadly about health and well-being, this is actually a key element. And here's the comment about the economic cost of mental health being greater than cancer, diabetes, and respiratory disease together. So after we kind of know the impact, the second principle that we have is break the silence. You know, we kind of live in a don't ask, don't tell world, right? Who would be up here talking about mental illness and their own mental illness or mental illness in their family? We just don't do that. But there are organizations that have taken active steps to start talking about mental health and mental illness. And Ian is going to give some great examples, so I'm not going to steal all of his thunder, just half of it. No, it's just some of his thunder. But what these organizations do is they will have a program that will talk about mental illness. And so DuPont was really the pioneer in this. They had a program called ICU where they developed a video that they actually shared with all their employees globally. And it was basically intended to say, if you see an employee who isn't themselves, reach out to them and ask them to get help. I mean, it was kind of that simple. And the idea was just to talk about it. There's another program that I was actually very much engaged with called I Will Listen. And the basic concept of I Will Listen is to say, if you've got an issue, I will not judge you, I will listen. And the idea was they actually created bracelets, and they too implemented those bracelets globally to help people engage on it. But there's a lot of other programs too. Right Directions is one. There's others as well. And one of the things that we learned when we did investigation on these things, it turned out it really didn't matter what that program was. EY has a great program called Are You OK? Again. But it didn't really matter what the program was. It turned out the experience that happened in the companies was similar in each of those instances. Because I remember having these calls with people. I say, well, how did it go? And they start talking, and you'd hear the same thing start happening. Once people broke the silence, once they had some pivot to help people better just start talking about mental illness, mental health, people opened up. Why? You know, if 1 in 4 people have mental illness, that means most of us know somebody who has a mental illness in your family or your friends or yourself. It just exists. And once you kind of break that silence, people start talking. And once they start talking, we've started to normalize, right? We've started to mainstream the conversation. And then what happens? People start using services like the EAP. People start understanding better about how mental health and mental wellness fits into that broader part of the strategy. And so I think that is a thing. You know, I kind of describe it as kind of waiting to exhale, you know. Finally, we can start talking about this stuff. Because otherwise, we just don't talk. And again, I think you think of this as moving beyond just being smoke-free to being stigma-free. You know, in our environment, we're here to support people, and it can be their emotional health, it can be their physical health, and whatnot. So the other key element, obviously, is access, and we talked about some of the issues on access. We, as the National Alliance, are really advocating for very progressive activities through the health plans to drive improved access in the networks, reimburse for collaborative care, those integrated care through primary care models. But also, I think there are other solutions that are out there, emerging technologies, telehealth, that can be helpful. I don't think it solves the issue. Because I think one of the dangers is people say, well, I got it fixed, I got telehealth. Because telehealth isn't going to deal with serious mental illness. It's going to deal with, moderate to mild mental health, and that's a good thing. That's a good thing. Same thing with collaborative care. We still need to deal with the network issues, which are bigger issues. In addition, there's issues as it relates to medication. So when you deal with mental health and you look at the portfolio of medications that might be available to deal with bipolar disorder or depression, those medications are not interchangeable. It turns out that some medications work for some people, and it's almost trial and error. The way physicians, psychiatrists prescribe is trying their best to try to get it right. And if one thing doesn't work, they try something else. And if that doesn't work, they try something else. Well, part of the implications of that are we need to understand that as we manage our formularies. But part of it is we need to consider processes that will help us get it right faster. Because if we get it wrong, we get another admission. Especially with serious mental illness, if we get it wrong the first time, we end up with second admission and maybe a third admission. So some of the technologies that are out there today that are promising are things like the words pharmacogenomics, where they're actually looking at your genetic code and looking at the history of people with that genetic code and which medications work better for people with that genetic code. The idea is to try to get what today might be like a 50% or less than 50% hit rate on the first try to something that might be up to 70% or 80% on the first try. Well, it doesn't, you don't have to spend much to actually improve quality and improve access to that. And again, we don't have, and one of the issues, of course, with mental health is, again, start with self-stigma. I don't have a problem. I try medication. It doesn't work. Clearly, I don't have a problem, right? Do you try a second one? Do you stick with the medication? Do you go on? We need to try to get to the right answer faster. And I think that's one of the issues. And again, I think as employers, I think we really do want to support the community resources that are available out there. And I was very active and continue to be active with NAMI, National Alliance of Mental Illness. And they have family support groups and peer-to-peer groups that, frankly, don't cost anything, but really provide a tremendous support for people who are going through these issues. And then finally, and Dennis kind of addressed this too, the environment has a huge impact on our mental health and well-being. It has a huge impact. And so on the one hand, I think there are people who are sick, so we don't want it all to go away and say it's all about well-being. There are people who have serious mental illness and they need support, right? But we can also prevent issues in our workforce by being more supportive of the workforce more broadly. And the good news is that the evidence is supporting well-being. There's a huge business case to support well-being. There's higher productivity, there's higher innovation, there's higher loyalty. If you look at this right-hand side, you see companies, cultural well-being is affiliated with higher profitability, more productivity, higher sales, more innovation, lower turnover, decrease in sick leave. It's kind of intuitive. If employees are at their best, if we have their backs, they'll have our backs too, right? And it's a good thing. And in my mind, employee well-being is very much interrelated with employee engagement. Think of employee engagement as people's commitment to the organization, their loyalty to the organization. Well-being is what the employee wants, and engagement is what the company wants. And it turns out the drivers of those two are very much interrelated. So I think we want to think that way. And finally, I would say when we start thinking about well-being, and even when we think about mental health, it's not all about health, healthcare costs. It's about people. It's about having people's backs. It's about helping them have great lives and integrating those lives with the lives at our organization. This, I think many people here might be familiar with the work that what used to be called Healthways Gallup did, and now they got another name, and I'm losing it. But they have 5 dimensions on well-being that they talk about. And what's interesting, and those dimensions include physical health, but they include community, financial, social, and purpose. And what's really interesting is if you're thriving in physical health, you would say, wow, you're going to have, people are going to be at work. They're going to be, they're going to bounce back from their illnesses more effectively. But it turns out if they're thriving in all 5 of those elements, they're 40%, they'll actually have 41% fewer unhealthy days. That it isn't all about the physical health that influences that. They're going to be 2 times as likely to adapt to change, 36% more likely to say they always fully bounce back from an illness. So our focus on well-being has, again, just positive ramifications from a health standpoint, but also from a social standpoint. 23% more likely to donate money, 43% more likely to have volunteers, 65% less likely to be involved in a workplace accident, and 81% less likely to look for a new job. If your life is going well, you don't think about changing it as quickly. And again, looking back at that issue around loneliness and isolation, connectivity is really a key to better health and well-being. Part of what has happened in our companies has partly driven by technology and our ability to work remotely and travel all over the place, is we have increasingly elevated the degree of loneliness and isolation, people who aren't engaged. And even within our organizations, there are subpopulations that culturally feel isolated as well. So if you look at your diversity and inclusion efforts, oftentimes that is also contributing to loneliness and isolation. When you're looking at this in a more holistic way, when you have this different lens of what we are here to do, you are inclusive about who matters and how we deal with it. You include other parts. This isn't just a benefits issue, right? And when you hear organizations that truly get this, they are crossing those elements. So here's a few stats. Loneliness is more prevalent than once thought. 65% ever experience significant loneliness. 50% experience loneliness in their public lives. And 35% are currently feeling lonely. That's a lot of people. That's a lot of people. And again, what this is about? This is about having people's backs. It's about including people in our community. It's about doing the right thing day to day, and not you alone, but actually developing a culture that is better connected and more engaged. And so, I think what I would say is we collectively are solving for the and, not the or. Yes, we need to improve access, acceptance, and value of behavioral health care. There is a health care issue here. At the same time, we need to align the organizational focus on individual well-being. And again, it's not in the absence of integration with organizational objectives. It's in concurrence with it. It's actually to solve for that together, not independently. So with that, and again, the key is to move upstream. Affordable, effective behavioral health support and a collective orientation towards mental health and well-being. So Ian, maybe I'll have you come up and maybe we can join forces afterwards to take some questions.
So for me, mental and emotional well-being is something that's is very, very important to me. But it took me decades to even own that, to even be able to appreciate how important it was to me. And I think that's because I grew up in an Irish Catholic family. I'm the eldest of 5. And I knew at a young age I was born with an optimistic outlook on life. I was positive. It wasn't that hard for me to carry myself in an up way. But other people in my life, they didn't get that card. They got a card that was different. So from a young age, I got curious as to the differences in emotional well-being. As I got older in life, life began to present me with what I call life moments. We all get presented with life moments, whatever they may be. They may be losing a brother. It could be caring for an elder, something that's going to shake your mental and emotional well-being. Growing up positively, what that meant for me was that I didn't have a framework to care for myself or even an appreciation of why would I want to take the time to do that. I was very religious about my physical fitness regime as well as nutritional, but this whole mental and emotional piece was quite foreign. Didn't even want to own that I had anxiety or I had fear or guilt or shame or whatever that looked like, because Ian was positive. So how could that be? I really had trouble reconciling that. I started to get familiar with therapy and the benefits of therapy, but then I realized, well, there's 6 other days of the week, right? And I still need to fine tune. Right? I still need to kind of make some adjustments. So I wanted to design a program, or really wanted to understand what could support look like for me. If you think of opening an accordion, where at one point in time, for me, it was very siloed around fix it, go see a therapist, and we come back. Right? But what about all the other modalities of support that could be out there, and how could I make it part of my culture? And so the reason I call the business I Am Human is it took me forever just to recognize that I'm human and I've got the blues today. I don't even know where those blues are coming from, but I've got them. Or I'm human and I've got some shame I'm feeling. Not quite sure where that's coming from, but it exists and it is blocking me from performing and engaging in my day in the best way possible. So I created my own blueprint for what mental and emotional well-being meant for Ian. What was something I was going to engage with each day? That consisted of me saving hundreds of articles and videos and underlining them. So when I read a particular line that made me feel a little bit better about my situation, I thought, well, that's supportive. Or maybe a video where in minute 334, a woman said something that shed a little light on what I was going through, made me feel better about my own mental and emotional well-being. So I put together a system of content, community, and experts, and that became Ian's blueprint. And I realized, okay, that blueprint is right for me, but I'm sure there's others out there that make sense for other individuals and companies. And I began to realize that if I needed the help understanding what initiatives would work for me from a mental and emotional well-being perspective, so do others, so do companies. You're seeing more and more leaders now, and you've heard about this today, more and more leaders are really getting out there and saying, this is important to us, not only at a business level, but at a personal level. Kaiser Permanente is one of the larger healthcare providers in California. This is the chairman and CEO. He made this comment a week ago, right? So this is all current. Not only are companies like Kaiser, J&J, Prudential, you have the tech companies as well, you have the banks getting behind this. They also want to be authors of redesigning new approaches to this. And this all goes to culture. I'm going to talk about that in terms of redesigning these initiatives. I like to look at it from a historical perspective, and we heard about this a little earlier, that there was once a point in time where physical fitness was not celebrated. So if you were out going for a run, you could have been viewed as irresponsible, taking time away from your family, taking time away from work. I mean, that was the paradigm. Nutritional fitness, when I worked on Wall Street in the mid-90s, if I had a salad on the desk, I was viewed as either sick or there was something wrong. And if I had made a suggestion that there's going to be half a dozen salad stores per block in Manhattan, people would have thought I was crazy. Right? So, and we now know nutritional fitness is well appreciated. This last piece, what I'll call the mental and emotional well-being piece, that's going to hit a trajectory over the next 2 to 5 years that will, I think, dwarf the first two. I've spoken to hundreds of companies, and it's pretty clear that companies understand the benefits, right? There's not that much resistance in terms of understanding the benefits and why we would do this. But the culture piece is really hard. It's like, okay, I know that there's a benefit to that, but there's so much out there. There's so much material. There's so much, I'm getting bombarded with information. Where do I start, right? Where do I begin? I spoke to a chief medical officer who Mike knows at an insurance company, and I thought he articulated this really cleanly. He said, we're really good at purchasing products, and he was specifically talking about HR and benefits, that the expertise that resides in those groups is good at making purchases, right? But the utilization, as we talked about earlier, the EAPs, no one's really focusing on that, right? And Mike kind of hinted at it, where if you can get there just a little bit earlier and understand what the needs are, you can then start to raise the engagement on EAPs. And that all goes to culture. Two other pieces of information that are just current. Jeffrey Pfeiffer is a Stanford University business professor. He's written 15 books in this space. He's a thought leader. And he talks about the fact that companies are not focusing on the environment, but they're focusing on the individual. And it's the environment that produces the culture and the resistance and or acceptance. Spoke to a woman at J&J. She said the same thing. It's a trusting environment around emotional well-being. It's all about culture. So when I talked about the blueprint that I built for myself, I had personal resistance to even embracing the fact that this was important. And I don't have anything diagnosable. I never had to go to a hospital to check myself in, but actually that's irrelevant. I still had things that were real to me and that were impacting my performance and enjoyment in life. And I don't view it as 1 in 4. I view it's 1 in 1. If you're a human being, you have mental health issues. It's impossible to not have that, right? So given that every company has got human beings that are going to be impacted, what's the right way to reach that? So we start by educating and inspiring. And so information needs to be presented in a way that's relatable or accessible. So let's just say your culture is one where you've got a lot of sports aficionados, people where sports analogies would relate to them. You could share a story about how Pete Carroll, the head coach of the Seattle Seahawks, recognized the importance in his team, and he reduced workout time by 20%. He said he did not need his employees, his players, lifting anymore. If that player showed up on a Sunday and he had a daughter who was bulimic, or if that player showed up on a Sunday who was caring for an elder and the elder was perhaps about to pass, to assume that's not going to impact performance is just wrong. So that first piece around educating and inspiring, it's really not asking the employee to do anything. It's just starting to paint a collage as to what's going on out there and why would this even be important. Assess, and this piece we talked about earlier, but talk about it again. We like to call it, think of like an emotional map. You have a map of the United States. Think about an emotional map of your company. Imagine if you could pick up a map and said, okay, these are all the hot spots of what's occurring in my company right now. I've got a population of parents who've got children with learning disabilities. I have a population of individuals who are taking care of an elderly parent. Wherever those stressors may be, wherever those emotional imbalances may be, is to start to build that map. And a key piece here is just the process of questioning, whether or not that actually gets answered. That starts that internal dialogue within, that internal acceptance, just that internal reflection. So that is a huge benefit in a process like this. And access, when we talk about access, Mike shared American Express's example. There's a lot out there that doesn't have to be defined under mental health. So Ian is not necessarily a mental health patient, but Ian still needs care. And you think about that accordion to open up, like what else is out there? There's so many different programs, modalities, experts that may be a great fit for your company that would not be defined under mental health, but still has the same types of impact. Implementation, delivery, track, and refresh. The key piece when you want to think about this, and this goes into just starting, that you're never going to get it right. This is not about getting it right. This is just about starting to raise the awareness and the signal that this is important to us as a company. And there's a great example, a Midwest example of an industrial laundry plant. And they are one of the largest who take care of hospitals, they take care of colleges, they take care of restaurants. I mean, they're cleaning laundry. The CEO realized mental and emotional well-being is important for our employees. This is a very mundane industry. There's nothing sexy about going to work here. And he rolled out a program, and he was able to calculate the cost of approximately $240 per employee. That's how much was dedicated to this program. And the return on that was 76%. And he had incredible data, but the biggest piece that was not in the data was just the loyalty. He said that from the moment I signaled that I was going to do this, I could feel it energetically. And that didn't get caught in the numbers. That was just the start, Some of the things you want to think about, and this really, again, goes to culture, is what language makes sense for your company. So for me, when I started building this business, I have a fairly traditional career background, fairly conservative, if you will. And when I told my folks that I'm building a business around mental and emotional well-being, I didn't even have those words. They looked at me like I had two heads. I had to come up with a language that would not enhance their resistance, but make them more curious. We use things like life moments. A life moment, there's nothing embedded in a life moment. There's nothing wrong with a life moment. There's nothing charged in a life moment. It's just normal, right? Oh, you lost your brother. Okay. The chief medical officer of the company I referred to earlier, he uses the term, let's demedicalize it. Let's take it away from that clinical, right, that closed accordion place and open it up. We're not fixing or solving anything. That's one of the biggest pieces from a personal perspective. Is there was nothing wrong with you. There's nothing to fix, right? You may just be in a state, and that state could pass, but we don't need to push it away, right? Meeting people where they're at, very, very important. Just where are you at? No judgments. There's nothing wrong. Your life moment is neither too big nor too small. It just is. Leadership commitment, ambassadors and culture champions. This is probably the most important piece. If there is not a senior leader who's going to get behind this, it will fall flat. If there's not a CEO who's going to get up and say, this is okay, and share a story, it's not going to have the efficacy. And then ambassadors / culture champions, there are people, let's just say this is an organization and each table's got a different life moment. There will be people who will be so excited that this has happened that they will wave their hand and say, I went through that life moment. I did that. I'm happy to be accessible for this. And the example that I can point to there is, I don't know if you know Senator Tim Ryan of Youngstown, Ohio. He put together a mental and emotional well-being program for a particular school district. Right? It was a very conservative, blue-collar school district. And one of the things he felt was that he was going to be viewed as this young whippersnapper trying to bring in a program to boost his popularity. He released the program. He went to visit and see what the results were. And to his surprise, all the teachers came up to him in a queue and said, we have been waiting for this. Right? In an environment where you would have thought there would have been a resistance, there were culture champions and ambassadors that could push it forward. And really what you want to do in terms of changing culture, you want to get it to a point where people feel comfortable of self-aggregating. Next Thursday night, we're going to get together. For any parent who's gone through this, we're going to get together and talk about that. Most of these employees and people who have gone through it already have resources that work for them, whether it was a book, whether it was an article, whether it was a community group that they attended. So the real key is how can you ignite that? And in igniting that, people are coming into work not only to do what they are there to do, they're also there to help others. It really enhances collaboration. The marketing piece, this is a funny example. I met with a woman from Deutsche Bank a week ago. And Deutsche Bank rolled out a program around mental and emotional well-being, and it had no uptick. And one of the things that they said was, well, that's funny. Why is there no uptick? And you know the posters that you'll see in your cafeteria about employment, compensation, employment rights, et cetera, these posters. Huh? And so they had a poster right outside the elevator, right? Every single elevator. And there is a perception that employees don't read posters. They just kind of go right through it. So marketing is a key piece. How do how do you bring awareness to the fact that this even exists? This goes back to the life moments that I was talking about before, and this is cultural piece, meaning how we arrive at work every day matters. Like to assume, and back to Pete Carroll didn't assume that his 350-pound lineman could show up on a Sunday whose daughter was bulimic and just forget that for the duration of the game. It's just not going to happen. And the costs of just addressing that are so minimal, so why wouldn't you? And this is some of the language I had to come up with for myself. You know, we are all human. We all have our challenges. Some we laugh about, some we don't talk about. But no matter what, they're real, and it could be a little one or a big one. It's irrelevant whether Ian's clinically depressed or not. I still have my things to work through. And so you may be familiar with employee resource groups. Think of that as a veteran group. Maybe it could be a group of those who've lost a spouse. The next iteration where this trend is going is around life moment groups. So let's say life moment groups are, I'm a sibling who's an Irish Catholic whose sibling came out as being gay. And in our culture, that's creating some stress. Right? My mom wants to deal with one way, my dad wants to deal with another way, but regardless, it's impacting me. And so to the extent you can start to create little life moments within your company, and from a statistical perspective, you know, millennials who make up more than 50% of the workforce now, and it's going to be up to 75+% between now and 2020. They don't want to identify and show up to an employee resource group. But if there could be something that they can be a part of many, right, online, I'm part of that group, I'm part of that group, I'm part of that group, it creates a sense of community. It creates a sense of collaboration. Mike referred to this earlier. Social isolation and loneliness, these are real epidemics. And they don't really manifest, you don't really see them, but they're only getting worse. And there's a craving for community, and a company can play a huge role in fostering that community. So where I wanted to fit in is, given my professional background, my love of business, I really enjoy business, and also my personal background of understanding how challenging it was for me to own that this is important to Ian and it's got massive benefits. And also the sense that there's no one path. I had a path that works for me, but that path is adjusting. I have to work at it every single day. Companies are the same. Each company is going to have a little bit of a different framework, a little bit of a different need, and that will be iterative. That'll change. But I wanted to add value to helping companies think through how this could work for them in a way that was of benefit to their culture and their employees.